Okay, good afternoon. So first, today we will discuss about your this letter. First, we just look through the some your case notes. Okay, so this is your case note that you send me. So the first thing in the case note that we have to see is this, our writing task. So to whom you are writing your letter? Dr. William Carlson, okay, for requesting his opinion. So what we can think about this, like this is a referral letter, okay. So first thing, you are writing to Dr. William Carlson, and the second thing is in the writing task is requesting his opinion. That means this is a referral letter. So I can sure that like you are very aware of there are three types of letters that have high chance to come in your exam. So first is referral, second is discharge, and third is transfer letter. So three types of letters have the high chance to come in your exam. So what is this letter is? This letter is referral letter. Okay. So you are writing to a doctor for requesting his opinion. Okay. And the second thing that I want to let you know is uh, in all the letters you are writing doctor to doctor or uh, doctor to AHP, like allied healthcare professionals. Okay, so I hope you all know what is allied healthcare professionals. Like it includes dietitian, physiotherapist, or occupational therapist. Okay, so you have to write doctor to doctor in some cases. In some cases, you are writing to doctor to allied healthcare professionals. That include dietitian, physiotherapist, and occupational therapist. So, what is the main thing? Why I said this to you? Because it will tell you how you can select the relevant information. So, in that situation, if this is a this writing case note is about this, like you are a doctor and you are writing to a doctor, okay, Dr. Williamson. So the selection of information would be different in that case. If you are writing to a dietitian, so in if you are a doctor means if you are writing to a dietitian, doctor to dietitian, so the selection of information will be different. If you are writing to a physiotherapist, doctor to physiotherapist, the selection of information will be different. Okay, so how it is different, like if you are writing to a doctor, like in this case, so you have to mention the medicines that you have given, the current condition, each and everything. But if you are writing to a dietitian, so the your more focus will be on the patient diet, exercise, calories consumption, okay, each and everything. If you are writing to a physiotherapist, so your more focus will be on exercises, some physiotherapist sessions, okay. So this how you can select the relevant information, okay. I hope you understand. If you didn't understand anything, so please let me know, okay. So we have discussed about that case note, and the next we have to discuss is this is your regular patient, okay. Subjective, what is subjective patient? That means like what patient says, okay. Objective, what You observe. We will make it simple. If it is difficult you to find it like subject, what is subjective and what is objective, just to make it like this. Okay, remember it like this. So now jump to your letter. Okay, I just want to make this video lectures very short. Okay, because I don't want, because I can understand that with your job it is difficult to you to watch big lectures, so I will finish it as much as possible. So this is right. This is right. Thank you for seeing Mrs. Margaret. She is my regular patient. Lately, she saw blood after bowel motions, okay, on the way to different occasions. Just please write it properly. I told you, I already told you, don't do hurry. When you are writing your letter, don't do hurry. Your examiner will cut the marks if you write like this. Okay, if you write like this, they will cut your marks. So that's why I'm saying again and again, when you are writing something, please write clearly. I can understand that this is, you wrote it different, but examiner will not understand what you have written. Okay, so that's why I'm saying please write clearly. Her father had bowel cancer at age of 15. Yeah, this is relevant selection of information. Okay, so in the case notes, I can see that like you are writing your letter because of bowel motions, because of blood in bowel in the patient. Okay, subjective. So okay, this is your first date. First date. First visit. This is about what you observe in the first visit and what make you assessment about the first visit. This is your second visit. Okay, this is your second visit. This is the patient second visit. This is the patient third visit, and this is the patient, sorry, where is the, for how many visits are there? So today's date 3/7/12. Okay, this is first visit 14/1/12. This is last visit. So I think I arranged pictures not properly. This is second visit. This is second visit. Yeah, so sorry for this. This is first visit, and this is third, means last visit, and this is second visit. Okay, so I arranged pictures little bit. So why you have written written that letter to that doctor, because why you are writing the letter? Why Dr. Williamson? We can say that Dr. Williamson is a specialist. Why you are writing the letter to Dr. Williamson? Because you are refer the patient to the specialist, because you cannot do something what the specialist can do. Okay, are you understand what I'm saying? Like why you are referring to the patient to your specialist? Because you didn't understand something, you assessed the patient very well, you got all the information that you need, but even after all the information, even after assess the patient, you didn't understand why this happened to the patient. Okay, so that's why you are referring to the patient. So that's why you are referring the patient to the consultant, to the specialist. Why you are referring? Because you didn't understand something and you want to refer the patient to the specialist, because you can't do something but the specialist can do. Okay, this is the main reason why we refer the patient in all the letters. In all the letters, like in all the referral letter, why we are doing refer to the specialist? Because we cannot do something but the specialist can do. Why the specialist can do, why we cannot? Because the specialist is more senior from us, she is more experienced, she has more knowledge than us, so that's why we are refer the patient. So in this letter, your format is not good. Okay, today we will discuss about what is format. Okay, your format is not good. First I want to check this. In view of above, I would appreciate if you provide an assessment of Mrs. Margaret and advice regarding further management. Okay, write like this. You don't have to write this. Okay, in view okay, even it is totally on you. If you want to write this, if you are feel comfortable this, you can write it. Even if you don't write it, it is totally okay. Okay, if you want to write this, write it. Okay, if you are comfortable with this, write it. If you don't want to write it, okay, it is also okay. So I would recommend write this line like this. I would greatly appreciated if you could. Yeah, so start your conclusion with this line. You wrote just I would appreciate if you, that you just wrote that is, but I would recommend write like this. I would greatly appreciate it if you could do that, if you could do that, if you could do assessment, if you could do management. It will shows more empathy, sympathy, more respect. This line shows more sympathy, more empathy, more respect. I would greatly appreciate it if you could. Okay, so Mrs. Margaret visited me 6 months before for regular checkup. She was overweight with borderline blood pressure. She was advised to lose weight, which she did very well. Okay, she did very well. Now blood pressure is also controlled, but on two different occasions she witnessed blood after bowel motions. Okay, she went through colonoscopy 3 years back, which was clear today. She is too worried for it. No, you don't have to include this line. She is too worried and has difficult. Yeah, she is worried. What? This is not our concern to writing the letter. We just want to get reference. What happened to the patient and has difficulty in sleeping, and no, this is not appropriate. I already told you don't use abbreviation. You have to write and proper. Okay, you can't use short forms. You can't use short forms in your letter. Okay, I prescribed her one tablet before bed. She doesn't. No, no, doesn't, does not. Any? Okay, so I will give even C. You this letter I will give C. Okay, so what the thing, because you did some grammar mistakes. Okay, I want to discuss today, I want to discuss something about grammar and something about your format. You cannot write does not, sorry, you cannot write doesn't, couldn't, don't. Okay, so instead of that you have to write does not, could not, do not, would not. Okay, doesn't, couldn't, wouldn't, don't, these all words are for speaking, not for writing. Okay, so I would not recommend you to use this. Okay, don't use this. Use this in your writing. These all words for writing: does not, could not, do not, would not. Okay, and you cannot use this and. Okay, you have to write proper and. If you will do that, if you will do these things, if you will do these mistakes, you would really lose your marks. Okay, so don't do that. Now I just want to discuss about little bit about format. Okay, so the next letter that you will send to me, I would accept you write like this. First paragraph, introduction. Second body paragraph. Why patient visited to me? What happened to the patient? Means current condition happened to the patient. Second, what I have done to treat that condition, including tests and treatment. Third paragraph, third body paragraph. Social history plus medical history. Fourth is conclusion. What to do next. Okay, so you write your letter like this. This is a proper format to write this. There are different kinds of format what we will discuss this it in future. Okay, so what it is, first paragraph including introduction, like I'm writing to refer Mr. Margaret who has been suffering from this and needs your further assessment and care. That's it. Second body paragraph, what includes second body paragraph? Why patient visited to you? Why patient visited to you? What happened to the patient? Current condition of the patient, what you did to treat that condition, any diagnostic test, any treatment that you have provided to the patient should be in second body paragraph. Okay, and your third body paragraph includes social history and medical history of the patient that is relevant. Okay, and fourth, conclusion. I would be greatly appreciated if you could do that, if you could do that, if you can do that. Fourth includes conclusion. Okay, so if in some cases, if there is no social history and if there is no medical history, or if you don't want to write this, so what you can do that, first paragraph is introduction, second paragraph includes what happened to the patient and what you did, like including diagnostic test, current condition, diagnostic test, and in that case third paragraph include treatment. Okay, in that case third paragraph include treatment, sorry, third paragraph include, in that case third paragraph include treatment. If you don't want to, if there is no social history and no medical history, then in third paragraph you have to include treatment, and fourth paragraph include conclusion. First introduction, second current condition and diagnostic test, third paragraph include treatment what you have done, and fourth paragraph include what is the next step. Okay, so today it is all about referral letter. Okay, so if you didn't understand anything, please let me know in the chat box, so I will definitely provide you this. So please follow my instruction that I provided in this lectures, and if you need any help, let me know. Take care.